Okay, I think we are live. Yes. So welcome everyone to this webinar on how to set public health exchanges. My name is Tommaso Pomerani. I am the Director on Professional Exchanges for the IFMSA, also known as SCOPE Director. I have with me other three facilitators from SCOPE and SCORE, of course, helping with the webinar. There is Nishwa, the Director on Public Health, also known as SCOPH Director. And then we have our two general assistants for SCOPE and SCOPH, named Iris Blom and Katja Cic, respectively. So Iris, and here you can see Katja as well. We're now going to talk about how to set up public health exchanges. As you know, it's a quite a new collaboration between SCOPE and SCOPH. We're going to explain what they are essentially, and also how to set up, so how to start public health exchanges in your NMO or local committee. I will now project the slides and leave the word to Nishwa for the first part of the presentation. I will ask my co-facilitators if they can see the screen.
Yes.
Are you able to see?
Yes. Yep.
Okay.
Yes. Thank you, Tommy. Hello, everyone. Welcome to the webinar. So we'll just go over firstly the outline of the webinar as to what we'll be talking about, and then we'll move on to the first topic of the webinar. So next slide, please. Thank you. So firstly, we'll be talking about what is public health in general, and then from that we'll put it forward to what are public health exchanges, why are we doing it, what are we really doing, and how do we plan to proceed with it. And then we have the public health procedures as to how do you apply for it, etc., etc. And then we have how can we fill in the internship form. And then we have how to approach tutors for public health exchanging, signing contracts, etc. And we will be taking your questions and answers at the end of the webinar. Next slide, please. Okay, so firstly, we're going to be talking about what is public health. So public health is the art and science of preventing diseases, promoting health, and prolonging life by collective measures of the society. There's something which you probably have heard before many times. But yeah, public health is any health measures that we take for the health of the masses or the public, which influence them. Even the plans that we have in working within our hospitals for the masses or how to serve them is public health. As you know, in IFMSA, not only do we want to gain expertise for our own individual work as what we do, but also we want to promote global health in all of its form and all of its ways possible. So that is why we, in a nutshell, we do public health, we study public health, or teach public health, and that is why, or the idea why we're having public health exchanges. So I'm going to leave it to Katja to go over the what, why, and how of the public health.
So why we decided to actually...
Just 1 second, I'll just switch to my screen because it seems that the viewers cannot see the slides. So we were talking, are you able now to see my screen?
Yes.
Tommy, can you also press present to everyone? Yeah.
Wait a second.
Yeah.
Yeah, you should be fine now. So, yes. Okay, so that was the agenda of the webinar and the definition of public health. Okay, so sorry, you can continue.
Okay, just please switch to the next slide. Why we decided to have public health exchanges, because basically we wish to empower students in the field of public health, because we realize that gaining field expertise in public health work can be very beneficial to us. We also want to educate students about the different approaches that are possible in public, international, global health, and so on. But as well set in different settings and in different countries, and also to help students develop intercultural competencies by experiences experiencing cultural differences in, as I said before, different public health settings. Next slide, please. Then going on to the what. So what are public health exchanges? It's an exchange in the field of public health and mainly primary healthcare sector. And it's been a collaboration between the Standing Committee on Practical Exchanges and Standing Committee on Public Health Exchanges, because we realized that within the IFMSA, such a collaboration can be very fruitful and will provide us with the best possible public health exchanges. And also, students from all health sciences faculties are eligible to apply, not just medical students. Next slide, please. And then continuing on to the how. So during the public health exchange, you can actually hold your exchange in different public health institutions. And you have 3 or 4 main options. The first one is governmental health departments. The second ones are non-governmental organizations that are active in the public health sector. And the third and fourth options are hospitals and medical institutes, including veterinary medicine institutes. Now, the public health exchanges can be anything from 4 to 8 weeks long, and include, as all other exchanges in the IFMSA, housing, boarding, and of course, social program if the hosting NMO is providing it. Next slide. Thank you.
Okay, thank you, Atia. So I'll take over the public health exchange procedures. But before we start with the public health exchange procedure, it's very important to understand that the collaboration of both standing committees is at each and every level, in content and in management. Next slide, please. Thank you. So going step by step as to what is the procedure of establishing SCOPH exchanges. The first thing is that you need to find a suitable institute to host the exchanges, and the NPO and the LPO should be working together and inform the NEO or the LEO about the initiative. As we just talked about before, that the institutes can be NGOs, can be government institutes, they can be hospital or management part of public health. Next slide, please. So step 2 will be assessing the available programs and identifying a tutor within the hosting institute by the LEO and the LPO. So a very good way to assess if that program is suitable for SCOPH exchanges is just going back to the goals and objectives of the public health exchanges in the regulations and see if the program that you're choosing or if the programs among the program that is available, which one would be the most relevant and suitable to the aims of the public health exchanges. It can be anything and mostly things which are of public health concern, but also something which will give a good idea to other exchange students coming in as to how in your country are you tackling a specific public health issue. And then there is an agreement which should be signed by the hosting institute and the hosting LC. Next slide, please. So the third thing is the public health exchanges internship form, which should be filled in by the tutor, and I will be talking about in detail about how to fill in this internship form in the next topic. Next slide, please. And then this is a short timeline as to what should be happening. So firstly, the internship form, if it is being filled by the tutor, needs to be sent to the LEO and LPO. And then it should be approved by the LEO and LPO. It should be approved by the NEO and NPO. So this is something which is more of internal NPO, internal NMO workings. And then the NPO should send it to the SCOPH RA and the SCOPH director by 17th of February for the March meeting and 17th of July for the August meeting. So you have 7 more days for sending in your public health exchanges proposals for the August meeting. And then at the end, within the 5 days of receiving after the deadline, which is from the 18th to the 23rd, they will be reviewed by the SCOPH director, me and Katya, the general assistant, and they will be, once they are approved, so the approval process is more of a communication between us and the NPO or the NEO. so we can go over things which can be improved within the internship form. And then once they're approved and signed and stamped by me, they will be sent to the SCOPE director, and they will be uploaded in the internship database. Next slide, please. So yes, so adoption of the public health exchange program and addition to the public database. Once they're, again, as I said, once they're approved, they will be uploaded in the public database. And what will be happening is, after all of them have been, like, the round for the August meeting has been done, there will be an email which will be sent to the SCOPH server and the SCOPE server about all the available exchanges, and a link to the database which would have the links to all the internship forms. Once the NPO has been notified by the SCOPE director for the approval, before uploading it into the internship database, they should be informing and notifying their national exchange officer about the approval. Next slide, please. Okay, so this is the internship database, how it looks like for the one that we made in the March meeting. It's basically an Excel sheet with all the internship linked to the internship forms and the exchange conditions, which so all of these are the ones which were approved for the March meeting. And there will be a similar one, an Excel sheet and a linked database formed after the August meeting proposals by the 25th of July, hopefully. And they are accessible in the Neo, Leo, and the student folder for SCOPE. And for SCOPH, they are available in the SCOPH public database. Their database is available through these two links. Katya, would you like to start the next step?
Yes. Thank you, Nisha. So continuing on to step 6, which is the promotion of the public health exchange contracts to other countries, to other NMOs, and the signature of the contract during the August meeting. So this is mainly done by NEOs. And the signing of contracts during the August meeting will be precisely for the next season. But in case you are interested in this season to host your exchanges and to have them, then please contact the SCOPD and SCOPD online, and the signature will be proceeding in a different way. Next slide, please. So continuing on is next step. The next step is the logistical preparation for the exchange, which is done by SCOPE. So the sending NEO or LEO will do the outgoing selection and send the application form. And then the hosting NEO and LEO will issue the invitation letter, take care of the accommodation, ensure there's a contact person, social program, and they will send the card of acceptance and anything else that is needed for the exchange. Next slide, please. So once the exchange is set up, then the student has to be prepared for the exchange, and he or she also has to be introduced to the tutor on the first day. So it is recommended for the sending LEO or LPO to collaborate and provide a pre-departure training for the student going on the exchange, and for the hosting LEO and LPO to work on the upon arrival training. There should be, or recommended is, a session on local health system and the primary or public health concerns, so that the student is eased into his exchange on the first day. And also for the hosting LC, an introduction of the student to the tutor or the department on the first day should proceed as scheduled, so the student knows where to start the exchange. Next slide. Thank you. The next step is delivering the exchange certificate if the requirements are fulfilled. So this is once the exchange has already been almost done. Now for the exchange certificate, the attendance of the student has to be equal or higher than 80%. And the student logbook has to be filled out by the student and the tutor. As well as the student has to also fill out the SCOPE evaluation form, which can be found on the database, and it has to be filled out before the end of the exchange by the student. Once all these requirements are completed, the student receives the first signature on the certificate by the tutor. Next slide, please. Thank you. So here on the slides, you can see how the certificate looks like, and on the right, you have the student's logbook. It's very similar to the SCOPE and SCORE exchange logbook that you previously probably already saw, and now we also have one for SCOPH exchanges. Next slide, please. Then the second signature on the certificate is done by the hosting NEO or LDO and NPO or LPO. And then the certificate is given to the incoming student and is taken back with him or her to her home country. Next slide, please. Now, for the certificate to be valid, there need to be all three signatures present, and the third signature can be gotten from the sending NPO, LPO, or NEO-LEO, which proves that the SCOPE evaluation form has been filled out. And also, once the student receives the public health exchange report, he or she has to fill it out as well. And once the exchange report is added to the database, the third signature is also added on the certificate, thus making the certificate valid. Next slide, please. So the exchange is evaluated in several different ways. One is the public health exchange report, which deals mainly with the public health and content aspect. So this is mainly for the SCOPH side to know how successful has the exchange been, what can be improved, and so on. And there is also the SCOPE evaluation form, which is found on the exchange database, and this is mainly for SCOPE to know more about the exchange aspects of the public health exchange. Next slide, please. After you, Nishwa.
Thank you. So here we're going to be talking about how to fill in the internship form, which you should be sending out to the SCOPH director and the RA by the 17th. Next slide, please. So this is how the internship form looks like. On a general review, it was sent out to the with the call which was open for the August meeting. And yes, so you have it, and it's in the Word document in the database, which has already been linked. Next slide, please. Thank you. These are the last two pages. Next slide, please. So the internship form is the official form for public health exchange internships. It includes the description and all the important information on the internship. It is to be filled out by the tutor and the LPO with the help of the LEO. It is important to understand that it is the only source of information that international students will see. For instance, it is the only thing which they'll be able to see regarding the public health exchange before deciding or when deciding as to which exchange they would like to sign up for. Next slide, please. So it has generally 5 sections: general information, description of the internship, requirements, schedule, and special remarks. Next slide, please. So general information, you must add the general information, which is the internship, the name of the internship project, the name of the tutor, the address of the institute, etc. In the type of the department, because public health exchanges are exchanges which you can have in multiple types of institutes, you need to mention which one of them it is. So you need to select out of the chosen options between a governmental institute, between a hospital institute, between an NGO. And if you think that it is not, if it's not in one of the options, then you can choose other. But please do specify as to what the institute is or the department is. Next slide, please. So description of the internship. So in description of the internship, there are a couple of questions which need to be filled, and we start with the problem statement. The problem statement should be clear and complete, and it is basically you need to answer what is the main public health issue which is being addressed during the internship. It should explain the current situation and the issues of the population at which the internship is targeted. Basically, it should be a problem statement which is well grounded. So, for instance, if it is a public health exchange in a city or etc., even statistics as to what the internship is generally aiming at, or why are they doing what they're doing. So, for instance, if we take one example of a tobacco cessation clinic, an internship there, then the problem statement would be that there are the number of people consuming tobacco, etc., would be the problem statement which you would mention here, and we have a limit of more than 3 lines so that it's explanatory enough, and less than 15 lines so that we have a concise internship form which everyone can review. Next slide, please. So the next thing is the goal of the internship, which is the overall aim of the internship project. What internship project wants to achieve at the end. So it will be something which will be reflective of the problem statement as to what way would the internship be aiming to solve the problem statement that there is. And then we ask the objectives of the internship as steps or actions to achieve the final goal. And it must be SMART, then it needs to be specific. The objectives need to be specific, measurable, achievable, relevant, and time-bound. And it's very important to have detailed and specific objectives. So even coming back to the tobacco cessation clinic, if, for instance, your goal of the internship is to have data analysis to help the research or etc. of tobacco cessation, then that would be your goal, and your objectives would be specific things as to what you're doing. Next slide, please. So the next things are the expected outcomes of the internship as to what results does this internship hope to obtain, which is again going to be reflected of the objectives once fulfilled. Then we have type of internships. So the internship type could be advocacy, campaigning, education, research, or clinical work. It can also be a combination of more than one. And if the type is different than the one which we have mentioned before, then you can always select other and specify what type it is. Next slide, please. So here, the next portion of it is about the exchange student's role as to what the exchange student will be doing in this internship, the specific tasks that are expected out of the student to accomplish, and what their role will be in the goal and the objectives that the internship aims to achieve or is working on. We also want to know about the practical skills and the knowledge that will be acquired by the exchange student, and what are the outcomes that they would have, for instance, if they have to present a poster or a presentation, etc. It is very important to be specific in this part, because this is the part which is beneficial for students to read up or to decide before signing up for an exchange and be prepared for it. Next slide, please. So then we have a section about students eligible for the exchanges. As you know, public health exchanges are open to all health science students. So it could be for medical students, but it is the choice of the hosting NMO as to which students are eligible for that exchange. It could be medical students, it could be graduate students, pre-medical students, or health science students. It can be open to one specific type or all of them, and it's important for the students to know that their level of studies is compatible with the internship project. And then we have a section on any other requirements or any other legal conditions that should be respected, which are exceptional to this public health exchange proposal that you're sending in, or if the student needs to develop specific knowledge or skills before arrival. So you can always add them there as well. Next slide, please. And then for the schedule, we ask if the duration is for 4 weeks, or is it more than that. Then the minimum is for 4 weeks, so it can be for 8 weeks as well. And you need to specify the number of working hours which are per day the student needs to work on. And then we have a section where you choose the available months that you can host this student for, and the total number of students that will be accepted in a year, and the specific number of students that can be accepted in one time period or a month. Next slide, please. And then special remarks is basically for anything that you want to add in, any basic reading, anything that you want the student, whoever will sign up for the exchange, to go over before coming to the exchange. Next slide, please. And yes, so with the internship forms which were sent out, there was also a guidelines document which was sent out. So please follow that guidelines document while you're filling in the internship form. It should be in Arial size 11. Send the internship form in a Word document so it's easier for us to sign and for you also to sign and to edit things in the period of the review. Please save the document with the title which is proposed here, and also send the subject of the email in that sense, so it's easier for us to proceed with that. And please send your forms by the 17th of August, 17th of July to the SCOPH@ifmsa.org and CC your SCOPH, respective SCOPH regional assistant. Next slide.
Yeah, that's me. I hope you guys can all hear me well. I'm super excited to be doing this webinar on this great new project. So now we're going to talk about how to approach tutors for a public health exchange. Next slide, please. Thank you. So I'm going to talk about 4 different steps, and these steps are outlined here. So first of all, it's important to identify yourself. Then second of all, you have to think about the message. Third of all, you have to think about the audience, and finally, you have to act. And I'm going to talk about each of these separately. Next slide, please. So in order to identify yourself, know who you are, and also be able to portray who you are, there are 4 things that are very important to take into account when doing so, in order to successfully do it when you're meeting a tutor. So the first thing that's very important is integrity. So this means that when you have certain morals, when you have certain values that you stand for, make sure to stand by them, so that a person knows that your integrity is actually something that is trustworthy, and that they actually want to work together with you. The second one is accountability. This means that when you say you're going to be somewhere at some time, you have to be there at that time. It's small things like that, but also answering your email like that. Or it just means that you have to be accountable for the things that you say you're accountable for. This also includes, for example, the fact that when we say we're going to organize exchanges, and we say we're going to get people from all over the world to a certain place to do this exchange, there will be an expectation that we will be doing so. So make sure that you are accountable for the things that you say you're going to do. Then the third one is transparency. Be transparent about what you do. Be transparent about the organization, how we work, how you're working. And then fourth of all, have professional capacity. This is a very broad concept, but basically it comes down to the fact that you should be able to portray yourself and act in a way that's professional. This includes a lot of things, including answering your email, but also the way you dress when you go to a certain meeting with a tutor, for example. And it can be seen in many different lights, but just make sure that when the tutor meets you and interacts with you, he will gain an image of you that has high integrity, high accountability, high transparency, and also a good professional capacity, because this will all contribute to the likelihood that the tutor will want to work together with you. So that is what I wanted to say about the first step. Then we go into message. So in order to do a successful approach to tutor, it's important to have a successful and efficient, succinct message. And in order to come up with this message, there's 3 steps that you can take that very successfully can approach someone and convince them to work together with you. So this starts with addressing a pain. In this situation, for example, when you're trying to approach an NGO that's working on a specific issue, you can say, hey, I see that you're working on this issue. I see that you're trying to raise awareness. However, you might lack some international insights or some international awareness on this topic, and that might be the pain that you're addressing. Then you should emphasize the unique claim that you're bringing to the table. So, what makes you different? Um, in our case, this is the fact that we are the biggest student led organization in the world. And also, we are the biggest. The SCOPH exchanges are now part of IFMSA exchanges. And as a whole, IFMSA exchanges are the biggest student-led exchanges in the whole world because we have the most students going on an exchange each year. So this is also something that you can have part of your message because we have the experience within our organization. And then lastly, prove again that the person, the tutor, will have by working together with you. So basically, tell him that with our international network, with our experience, we'll be able to provide something. We'll be able to provide a student with the experience, or with the insights, or with just that different thing that they might need to address that pain that was said in the first place. And this is just an example that I used to explain this concept, but it can be used in many different ways. Just keep in mind these 3 parts of having a successful message. Next slide, please. When you're talking, the third thing that you have to keep in mind is your audience. So just an introduction of concepts. When you're talking to an audience, you can talk to a primary audience, meaning that you talk to someone that directly has to do with the goal that you're trying to reach. However, you can also talk to a secondary audience, meaning you talk to someone that then will talk to the primary audience, which will then lead to the goal you want to reach. So this might have to do with talking with a tutor directly, which will be primary audience, but you could also be in contact with a secretary first, or another party in the chain. And it's important to keep in mind who you're talking to, because when you're talking to the secretary, for example, you want to frame your message differently because you want to reach the tutor. And when you want to reach the tutor, you want to frame your message in such a way that you want to reach that spot for a student. Next slide, please. So again, tailor the message to the audience and make sure to be ready and answer the question, why would a tutor like to take a student? This could be many different reasons, especially in SCOPH exchanges where there's many different institutions that you could work with. So keep in mind what the institution is doing and how an international exchange could contribute to what they are doing, or the tutor personally. In SCOPE, many times we bring an international network to uh, uh, a department, but you can think about other things as well. Next slide, please. So these are just some examples of arguments in favor of public health exchanges for tutors, which you can go over. Free labor, it's an easy one. You have students who are not paid. You allow intellectual and cultural exchanges on different or similar public health issues. You provide different perspectives. This is a very important one because people come from different backgrounds with different experiences and might therefore very much provide a different perspective. International exposure, teaching language and language experience for the institutes which they might need for certain goals. And finally, because public health integrates different disciplines and requires collaboration, this might be a very important thing. Next slide, please. And the last thing that I wanted to say is that the most important thing is just to act. There might be very much things that you don't expect that happen when you approach a tutor or an organization. So you can't prepare for everything, but as long as you know what you want to reach, what you want to do, and what our public health exchange program actually is, so you have all the facts straight in your head. And the most important thing is just to do it. Just pick up that phone, write that email, and just go ahead and do it, because you can achieve a lot if you just go for it. Next slide, please.
Okay, thank you, Iris. Thank you very much. So I will move on to the next part, which is about signing contracts for public health exchange. As you know, we are close to the August meeting, which is a very important meeting when in SCOPE and also in the SCORE sessions, we have a moment called Contracts Fair, where the NEOs and NORIs sign contracts for the upcoming season. And this is the start of the signature of contracts. In general, contracts can be signed throughout the whole year. I'm now just explaining the procedure for signing contracts and what is the specific procedure in case you want to sign contracts for public health, for a public health exchange. So I will start. Of course, if your internship project has been approved and added to the internship database, that means that you, and by you I mean you as a NEO or on behalf of your NMO, you can sign contracts for public health exchanges with NEOs of other NMOs. I'm talking specifically about NEOs in this case because this is a responsibility of the NEO. In this case, it's of course important that the NEOs and PO in this case and the LPO encourage the NEOs to sign contracts once the internship form is approved. The contracts can be bilateral or unilateral, which means that in case of bilateral exchange, you have a student going from NMO1 to NMO2, and then another student going from NMO2 to NMO1. In the case of a unilateral exchange, there is just one NMO that sends a student to another NMO who at the same time receives the student. As I said, contracts can be bilateral or unilateral, but must abide by the SCOPE regulations. And one of the things, for example, that is written in the SCOPE regulations are that unilateral contracts must not exceed 40% of total incoming units. This is something that the NEOs know very well normally, so it's mainly just as a reminder for them also, or for you, if some of you who are watching us now are NEOs, to just remember that the contracts must abide by the SCOPE regulations. At the August meeting, so what happens during the August meeting? Normally, NEOs can sign contracts during the August meeting. They can do it only during the contracts fair, which is a specific moment of the SCOPE and SCORE sessions, which is present in the agenda of the SCOPE SCORE sessions for every August meeting. You must use the official SCOPE contract form. In this case, you're signing contracts for a public health exchange. You must use it's a collaboration between SCOPH and SCOPE. You must use the official SCOPE contract form that you normally use for signing regular professional exchanges, contracts for professional exchanges, the classic ones with other NMOs. You must, however, specify how many units of these contracts that you sign with other NMOs are bound to a public health exchange. In the contract remarks, there's a specific space in the contract form where you can specify additional remarks, and in this case, you must specify how many units are bound to a public health exchange, which means that that will be the specific number of students that you will send on a public health exchange, and they will have to choose public health as department. They will have to choose a public health internship among the ones that are listed in the internship database. After the August meeting, then, once you sign the contract with the other NMOs and you go back home, then the contracts must be registered on the database as soon as possible. Make sure to specify how many units are bound to a public health exchange also in the database contract remarks. There's, again, a specific field on the contract page on the database. The NEO have access to the specific link in their NEO panel, which means their NEO account on the database, where they can send contract requests to other NMOs, which of course must respect the numbers and the agreements that have been signed and stamped during the August meeting, but also make sure to specify how many units are bound to a public health exchange also on the database. There are, however, two situations that might happen during the August meeting. Because if there is a representative from your NMO at the August meeting, but in this case, there is no NEO. So I'm talking about the case when the NEO cannot attend the August meeting, but still there is a representative from the NMO. Then the representative can sign contracts on behalf of the NEO and the NMO only if the NEO provides the SCOPE director with their name of the representative and email address within 2 weeks prior to the start of the August meeting, which means mid-July again. However, if there is no NEO and there is also no representative from your NMO at the August meeting, unfortunately, this means that you can only sign contracts on the database after the day of the contracts fair. So it's not the end of the world. You can still sign contracts. The procedure is different. It's just that you can sign contracts on the database after the day of the contract fair. This also applies for contracts related to the current season. If you still want to sign contracts for the current season, which will end on March the 31st, then you will have to sign them on the database. We always recommend to fill in the contract form and send it by email if you're not present at the August meeting before registering the contract on the database, because this will make sure that you still have a physical copy that is also scanned and then sent to the other NMO of the contract, which includes all the remarks and the number of contracts that are bound to a public health exchange, and even the additional condition or additional requirements set by the NMOs that are signing the contracts. So to just avoid any kind of problem, we always recommend to fill in the contract form, even if you're just signing contracts on the database. You can just exchange it via email. But what happens after signing the contracts then? Once the contract is signed and registered, the NEOs must notify the SCOPE and SCOPH IT about the contracts. So this is mainly a task of the NEO, of course, because only NEOs can sign contracts. They have the account on the database. But then they must notify the SCOPH IT and the SCOPE IT about the contracts, so that the SCOPE and SCOPH IT can monitor the advancement and the progress on this project, which is still at the test phase. As you know, it's still a very, very new project, and we are testing, and we want to make sure that everything and every step proceeds smoothly. So we want to know essentially from you if you sign contracts specifically for public health exchange, so that we can provide you with a document on also how to fill in the database application form, the database card of acceptance, the card of confirmation, and the evaluation form in the end. The specific differences, let's say, are just listed here in these slides, and I'm just going to quickly explain them. So what happens with the application form? Normally, students must fill in the requested information regularly, except for the following points that I'm going to mention now. The student's medicine-related info, because as we know, the rest of SCOPE exchanges are for medical students only, because they are medical exchanges. But in this case, public health exchanges are open to all health science students. So in the case when the student is not a medical student, then the student must fill in that field as if for their current studies. So that's essentially the year of study, and the year of study is essentially applies to the year of their study related to their course, whether it's I don't know, different, for example, nursing and things like that. It still has to be filled in as if for their current studies. Just disregard the fact that there's medicine written on it, essentially. Exchanges preference. There's also another field that you must pay attention to if you're a student. The student must specify the city of their desired projects, because the projects are connected to a specific university, which is in a specific city, of course, which means a specific local committee. So the student must specify the city of their desired project and select public health as desired department for all the 4 options, because the student is applying to a public health exchange, so it's bound to a public health exchange, and they must select public health in all the 4 fields. Normally, students are required to express 4 different preferences of department, but in this case, they have to select public health. And then the additional notes from the student where they must specify the title of the internship they're applying for. So the student is applying for a specific internship, of course, and they must specify the title of the internship in the additional notes, so that the hosting NMO will be able to understand the specific internship the student is applying for. Oh, of course, if you have more than one internship in the specific NMO, you have contracts with and you're interested in more than one, you can just express both of them, or more than one, or more than two, and then of course you will be assigned to one only in the end. The card of acceptance. In the case of the card of acceptance, the LEAs must fill in the card of acceptance regularly, except for one thing, that and the fact that this thing is the fact that they must mention the final internship project in the CA remarks. Of course, the student needs to know the projects he or she is accepted for. And then the card of confirmation. For the card of confirmation, which is filled in by the student, there is no different from the classic SCOPE exchange. For the evaluation form, the student should pay attention to the following two things. The students should skip all the questions related to clinical exchanges by filling out non-applicable or leaving the field empty wherever is possible. And for the question about current year in clinical studies, they must fill in as if for their current year of study. So disregarding clinical studies, medical studies, and things like that. Again, for the reason I explained before when I was talking about the application form. Are you confused? Well, me too, because yeah, it doesn't seem easy, but in the end, it's actually easier to do than to explain. So don't worry about that. Also, don't worry, because all NEOs who sign contracts for a public health exchange will receive a database flowchart explaining the steps to follow when applying for a public health exchange. This flowchart, please make sure to send it, of course, to your LEOs and students who are applying for the exchange. This is why it's also important to notify the exchange of the SCOPE and SCOPH IT, because we will be able to provide you with the database flowchart and also assist you in this procedure, because as I said, it's still a project in the test phase, so we want to make sure that everything proceeds smoothly, and therefore we are giving you all the instructions on how to apply successfully for a public health exchange. As a final thing, I would like to mention the public health exchange folder, of course. We talked about a series of procedures, a series of documents also, which has been mentioned throughout the webinar. Well, there is a public health exchange folder, which includes all the useful documents for public health exchanges. And you can find it if you are a SCOPE addict. You can find it in the NEO, LEO, and student folder, depending on your position. And if you're a SCOPH hero, you can find the public health exchange folder within the SCOPH public database. So it's easily accessible. All members of the two standing committees can have access to it. And this is it. So in case you have any questions now, the PowerPoint is over, as the picture says. And we are sure that we have many questions to ask us. So I don't know, Katja, are you able to see the panel with the questions? Of course, if you want to ask questions, you can still do it. We have some minutes that are dedicated to question and answers. You can use just the panel on the right of the YouTube page with the video that you're watching. Make sure to write them there, and we will answer as soon as possible. Do we have any questions?
No, there are no questions so far. Still waiting.
Okay, so we will wait a little bit in case you have questions for us. Also, if you want to watch the webinar again, if you're afraid to lose all this information, don't worry, because the webinar is saved on the IFMSA YouTube account platform. So you will be able to watch the webinar again, the video again, at any time and whenever you want, of course, so that you can just review the steps and rewatch the specific things that you might have missed, or that you want to just watch again to just clarify your doubts. we don't have other questions, I guess. Feel free to ask whatever you want related to public health exchanges, of course. So we don't have any questions. Katya, you confirm that we still don't have any questions, right?
Yes, yes.
Okay. So I would say that probably this is a good sign, maybe, I don't know. It means that we have been clear enough with the explanation. I hope that this is the correct interpretation. So at this point, I would say that we can just say goodbye. And I would like to thank you, all of you who are watching this webinar, who have watched the webinar from the beginning till the end. So we can maybe...
Tommy, we received one question.
Oh, good.
Before
Okay.
we wrap up. From Ivan, he's asking that he would like to know whether we can still send out unilateral outgoings or not if my NMO hasn't opened public health exchange yet. Should he contact his NEO about this?
So whether or not it's possible to send unilateral outgoings to another NMO who has public health exchanges, if I understand correctly.
Yeah, I interpret it in the same way.
Okay, so if our interpretation is correct, of course, Ivan, feel free to tell us if it's not, if we didn't understand the question properly. Yes, this is possible. Of course, it's possible because unilateral contracts are also possible. So you can send students to an NMO that is organizing public health exchanges. I don't know if anyone wants to add anything else, but like in this case, the question is quite, the answer is quite simple. Okay. I hope we answered your question. And if not, in any case, if you have other questions, you can also contact all of us. So our email addresses are ga.scoph@ifmsa.org. This is Katya email address. ga.scopy@ifmsa.org. This is Iris's email address. And then my contact information, my personal actually, the SCOPE director email is the scoped@ifmsa.org. And then Nishwa's email, the SCOPH director email is scofd@ifmsa.org. So you can contact all these addresses, email addresses, if you have any questions and you didn't have time or you didn't have the chance to watch the webinar live, you can just ask them by email. Ask us by email. Okay, so this is it. This means that we are gonna end this webinar. So again, thank you very much to everyone who watched the webinar, and thank you very much, Nishwa, Katya, Iris, of course. And I don't know if you want to show your faces again. All right, so goodbye, everyone. Thank you again.
Bye-bye.
Bye.
Bye-bye.